Well, hello and welcome everybody. Thank you for joining today's session. I'm Melissa Mello. My pronouns are she and her, and I'm one of the coordinators here in the new Rady Faculty of Health Science Family Center. In this center, we're here to support learners, faculty, and staff as they navigate the challenges of major life changes, including the challenges of caregiving while studying and working within the Rady Faculty of Health Science. And another one of our main goals is to try to create a more family-friendly campus here on Bannatyne. So today's session is Employee Maternity Parental Adoption Leave Information Session, and our speaker is Allison Stephen. Allison is the manager of the HR Service Center in the Human Resource Department, which is responsible for processing all employee life cycle events. She develops and delivers HR system training to staff and is the HR specialist on maternity, parental, and adoption leaves. Allison earned her business admin degree from the Université de Saint Boniface and is a chartered professional in human resources. She's been working with the University of Manitoba for 19 years in a variety of roles and working in HR in an HR capacity since 2010. Allison's pronouns are she and her. And in this session, Allison will explain the different types of leaves, how to determine eligibility, U of M top-up options, and the forms that are required to register for your leave. Before we get into this session, I would just like to do the land acknowledgement. The University of Manitoba campuses are located on the original lands of the Anishinaabeg, Cree, Oji-Cree, Dakota, and Dene's people, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to moving forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. And just before we begin too, I have a few housekeeping rules. If we could keep our mics muted until the end of the presentation, there'll be a period for questions. Or if you like, you can write your questions in the chat box to Allison and she'll get to them when she has a chance. And I also should mention that this session is being recorded and will be posted up to the Rady Faculty of Health Science YouTube channel at a later date. And so without further ado, here's our speaker, Allison Stephen.
Hello, everyone. Welcome. Thanks very much, Melissa, for the introduction. So yes, I'm here to speak with you today about maternity, parental, and adoption leaves at the U of M. I've got a little bit of an agenda here. And this is the first session that I've ever put on this topic. I've been processing the applications for leave for about a year and a half. And prior to that, the successor, she used to put on some sessions in person back when we were working, no one was working remotely, but now we're getting back into it, and actually having a virtual session is great for reaching anyone on both the campuses and people maybe who don't, we can fit it in on their lunch hour. So for the agenda for today is I'm going to talk about the two main types of leave, Plan A and Plan B, which I'll go into detail a little bit further. The eligibility requirements for each, also the difference between a standard leave and an extended leave, the procedure to apply. I'll cover some scenarios, and then I will also go through some commonly asked questions. And also, yes, as Melissa mentioned, if you do have any questions as the session is on, feel free to put them in, to write them in the message board. And hopefully maybe Melissa can nudge me if there are some coming in. But also I'll hope to save some time at the end for questions. Okay, so I'll get right into it. Now, the university has a policy and procedure, which is under our governing documents. This is the link to it here. And so it impacts basically all of the groups that are not unionized. So one of the main ones would be EMAPs. In medicine, there are the geographical full-time staff, so GFTs, basically every other group. And so they would be covered under this policy and procedure. Now the unionized groups such as UMFA and ACES, their procedure is outlined in their collective agreement. And it is very similar to the U of M procedure, but there are some small differences. So if you are maybe an admin staff advising for an ACES employee or maybe an UMFA member has questions, it is always important to consult the collective agreement just to make sure there aren't any differences than the regular procedure. So one of the big differences for UMFA members, actually, they are eligible for maternity and parental leave day one. So the day that they start, they could go on mat leave or parental leave and receive top up. Now, whereas, as I'll cover a little bit later on, most employees would need to be working full-time for 12 months. So that is a very big difference. The other thing is with UMFA and ACES, there is a new ruling where if both employees, both parents are in the bargaining unit, they are both now entitled to parental leave, whereas before they had to share the 1 year or the 18 months. So that is another big difference. It hasn't quite been rolled over to the non-unionized groups yet. So in summary, the university offers 2 maternity leave plans, Plan A and B. Plan A, usually when you think of Plan A, you would think that's the better option, but actually Plan A is the leave without any top-up allowance. So basically a leave without pay. So Plan A, maternity leave without allowance. Plan B is the leave with allowance. We also have 2 parental leave plans, Plan A without allowance and Plan B with allowance. So employees that are eligible may apply for both the plans, but they cannot mix and match. So if you are taking a Plan B maternity leave, you would also need to take the parental leave Plan B. And the maternity leave is only available to the mother giving birth. So the other parent would not be eligible for the maternity leave portion. And also parents adopting a child are not eligible for maternity leave. They're only eligible for parental leave. So I'm going to go over the Plan A fairly quickly because Plan B is what most people tend to take. And there's a lot more, there are more steps involved. So I'm just going to give you some details about the Plan A maternity leave. So that is for the mother giving birth. So the duration would be up to 17 weeks of time off. There is no pay provided from the university during this leave. The employee's service would continue to accrue. Their vacation does not accrue. And because they are not being paid by the university during this time, their benefits and pension, if applicable, they are not covered or they would not be paying into this. It is a voluntary option. And if the employee wants to continue either benefits and or pension, they would need to pay both the employer and the employee shares of it. And the way they would do this is on their form, they would indicate they want to keep these things going. Benefits and payroll would be in touch with them and they would have to write post-dated checks to continue their benefits or pension contributions. There is no obligation to return to the employee's position after this leave. And they are still eligible for EI benefits. So as long as they've worked enough hours, even though the university is not paying them, they can apply for EI and receive up to 55% of their income for the 17 weeks. The parental leave is for the adoption of a child or becoming the natural parent of a child. And so this could be for a mother who has already taken the maternity leave portion. Now she's continuing on into the parental leave, or this could be just the other parent taking parental leave. There are 2 streams, and this was more determined by Service Canada. So we're following their language. So the standard parental leave is basically for if it was a mother having a child and taking maternity and parental leave, this would be for like a 1 year maximum leave, and the extended would be for an 18-month maximum leave. So if it's the mother or the other parent taking the parental leave, they are entitled to 37 weeks in one consecutive period, and it must be completed within 12 months of the child's birth or adoption. The extended leave, they are entitled to 63 weeks of time off taken in one consecutive period, and it must be completed within 18 months of the child's birth or adoption. So for the parental leave, whether it's the standard or extended, there is no pay from the university. The employee's service would accrue for the first 16 weeks of the parental leave. Their vacation does not accrue. Benefits and pension contributions are voluntary, as with the maternity. So they would have to prepay with post-dated checks, and there's no obligation to return to the position, and they are eligible to apply for EI benefits. So for eligibility, who would be eligible for Plan A? Well, you need to be working at the time of your leave. You need to have completed your probation or else 7 months of work. You need to apply 4 weeks in advance by filling out the leave form and having your supervisor or department head sign. And for maternity, you would need to also include a doctor's note showing your anticipated due date. In the case of parental leave, you would need to either show that piece of paper as well, showing that your baby is going to be born on X date, or in the case that the baby is already born, screen print or copy of the birth certificate, or the order of adoption. So now we'll go over the Plan B, which is the maternity and parental leave with allowance or with salary top-up. So before we go into people who are eligible, there's in the procedure, the UM's procedure, there is a section where it talks about who is not eligible for Plan B, and this would generally be people who would take the Plan A. So employees who are on reduced appointments or employed for less than 1 year, employees who are in a temporary term, contingent, or project position. Now I put an asterisk there because that is a little bit of it depends. I'll get back to that. Also employees in sessional, part-time, or casual positions. So these employees would generally apply for Plan A and have the time off, but no pay. Now, the procedure says that people in a term or project position are not eligible for Plan B, but that, we are not following this practice. To be honest, I have seen a lot of people in project positions that do get Plan B with the top up. And even if their contract end date is maybe only 6 months from now, they may, it's just that their benefit would stop when their contract end date is reached. We also have a lot of cases of research associates and postdocs, and a lot of them get Plan B. So that's why I put the asterisk. So although in the procedure it does say they are not eligible, maybe it's best to talk to your HR consultant or to consult me, and I can let you or them know if they are eligible or not. So for maternity leave Plan B, it's for the mother giving birth. The duration of the maternity leave portion is up to 17 weeks. And that would be, the university will provide salary top up. So we would give you 2 weeks of 100% of your salary, which we call while you're serving the waiting period. And we give you 15 weeks of salary top up at 45% of your salary. So the idea is that you will apply for EI and they will pay up to 55% of your salary. And then the university tops up the remaining 45%. So in total, you would get 100%. So that is the maternity leave payment piece. Your service continues to accrue, your vacation accrues, your pension and benefits continue. And one of the conditions though for being eligible for Plan B maternity leave is that you will have to apply for and be approved for EI benefits and provide proof that you have received the EI benefits, which I'll get to. And also you need to sign something on the leave form that says you will return to work full-time following your leave, and you will return for the duration of leave. So for example, if you took the 17 weeks of mat leave, you need to come back for at least 17 weeks full-time to basically pay it back. Otherwise, you would need to repay that to the university. The parental leave is the purpose is to provide time off for childcare, which is necessitated by the birth of a natural child or adoption of a child. And where parents are both employed by the university, if they are not both in ACES or UMFA, they have to share the parental leave portion, and they can only take either the standard or the extended And if the mother takes standard, then the parental leave would have to be standard as well. Or if it was extended maternity leave, then they would have to take extended parental leave. So the duration of the parental leave is, for standard would be 37 weeks and extended leave would be 63 weeks. So a standard basically would be if it's for a woman having a baby and she's taking the maternity leave as well, maternity leave plus the parental leave, it's basically they would be gone for I guess I'm going to get to another piece where there's also an unpaid leave portion, but the standard leave is basically 12 months or less, and the extended leave would be for an 18-month leave or less. Now, the university pays the salary top up for the first 18 weeks of this. They don't pay the entire 37 weeks or 63. So regardless of which stream you choose, the university will only pay the salary top up in the first 18 weeks, and it's for 40% of your salary. So EI will be paying 55% and we pay 40%. So combined, you would get 95% of your salary. Now, for both the Plan A and Plan B, there's also an unpaid parental leave portion. So as I mentioned before, they only pay 18 weeks of parental leave. So what happens after that? If you want to be gone a whole year or you want to be gone 18 months, the rest of it is called an unpaid leave. That's how the university considers it. And so you are not receiving any pay from the U of M. You would get, if you were taking standard, you would get 55% of your salary for the remaining portion up to the 12-month mark. If you take extended, you would get 33% of your salary through EI for the remainder of the 18-month period. So for Plan B, the university will always pay you at the front end of the parental leave. So we would pay you like the first 18 weeks, and then after that, we don't pay you, and you're on EI only. And so that's important to think. It's sort of hard to put it in your mind, like we've got sort of the U of M payment stream and then the EI stream, which goes longer than the U of M's, except they pay a lesser amount. They kind of pay it throughout the whole duration, whereas we pay all ours up front. And the reason for that is it's more consistent. And if you do decide you want to come back early, then you're not missing out on any of our U of M top up because we've paid it all sort of the beginning piece. So for the unpaid leave portion, you will not get any pay from the university. Your service does not accrue. Your vacation does not accrue. Benefits and pensions do not continue. So that's where you also have the option of paying with the post-dated checks. And that is something that you would fill out on page 4 of the leave form. And we'll go through the form in a little bit. Do we have any questions yet? I know there's a lot of talk about weeks and amounts. And I think that's why everyone finds it a little bit confusing because there's different streams and plans. If you want to save your questions till the end, that's fine as well. Okay, so I've got a little table here for eligibility. So to be eligible for Plan B, for the top up piece, you need to be working continuously full-time for 12 months prior to your leave for both maternity and parental. You need to apply 4 weeks in advance, provide a doctor's note with your anticipated due date for the maternity piece. If you're adopting or are taking the parental leave, you can either provide the doctor's note with the anticipated due date or the copy of the birth certificate or order of adoption. You will need to provide proof that you've been approved for EI, and that happens, you have within 8 weeks or six to 8 weeks to prove that or just provide that to HR. And on the leave form, you need to sign and agree to coming back to work full-time following your leave. Otherwise, you need to repay all of the benefits that you received. So the procedure to apply, and this would be for A or B, would be filling out the request for leave form, attaching the doctor's note or copy of birth certificate, depending on which leave you're applying for, have it signed by yourself and the supervisor, or depending on your unit's process, but generally sometimes I see just the supervisor signing or the business manager, whatever your process is internally. And email the leave form and the note, birth certificate or doctor's note, to hris@umanitoba.ca 4 weeks in advance of the leave. Now, if it comes in 2 weeks in advance, we're still going to process it, but generally it's nice to have 4 weeks because sometimes baby comes early, and just so we can, make sure we have enough time to collect all of the information if anything is missing. So I have a link to the form, and I believe I have to quickly stop sharing, or maybe I can just actually reshare. New share, I'm going to do that. So the form is available on SharePoint. Hopefully everybody can see that. Melissa, maybe message me if you can't. The leave form is, pardon me?
It's good.
Okay, good. So it's pretty busy, I have to say. We use it for other situations as well, not just the maternity and parental leaves. We use it for sick leaves, jury duty, all sorts of leaves. But you mainly need to fill out pages 1, 3, and 4. So the top section is just the employee's information. Down below, I'm just going to make it a little bit bigger here. So section C is very important. You know what? I have to, unfortunately, I can't, it's not able to fill the fields, but basically from C, you would hit the drop down and you would pick maternity leave, plan A or B. I believe it actually says maternity/parental. You pick that. So the main thing is we need to know, are you taking A or B? Those are the very big decisions because one is paid top up, one is not. So you would pick that, you would put the start date of your leave and the expected end date. You would sign and have someone, supervisor or dean director, sign. Page 2, you can skip. This is for other types of leaves. Page 3, you would put, if it's for maternity, adoption, parental, you'd pick. And if you pick, I really wish I could, maybe I have to download this. I'm just going to see if that works better. So the main thing is you'd want to pick like birth or adoption. Easier. See if it lets me open it. And this is another important question. It's, do you have a spouse or partner who will be serving the 1 week waiting period? So the 1 week waiting period is something that Service Canada developed. And it's kind of like they make you wait a week before I guess they need time to process the EI benefits, but you don't get paid during that week. But the university is very generous and they've offered to pay 100% of your salary during this 1 week. So if you are, say, the person not giving birth, you're the other parent, and the woman giving birth, your partner, has served the waiting period, you cannot. So only one person can serve the waiting period. So usually it's the person giving birth. But if the other parent is the only one who's entitled to EI benefits, then maybe they are going to serve the waiting period themselves because the woman giving birth would not be claiming EI if she's not eligible or if she's self-employed or something like that. So that is, so yeah, the spouse partner who goes on leave first serves the 1 week waiting period, or in the case of, yeah, if the mother is not applying for EI, then it would be the other parent. Then here we're asking, do you have a spouse or partner who works at the U of M? Yes or no? And that way, depending on what like employment group you fall into, you either can have your own parental leave portion or you have to share it. So we need to know if your partner works at the U of M. And then it asks, if you're taking parental leave, are you applying for the extended parental leave and how many weeks? It's also helpful for us to know about vacation purchase plan if you're enrolled, because when you're going on a leave for 1 month or more, you actually have to get your vacation purchase plan reconciled, and we pay out whatever balance you would have if you haven't used your days yet, but you've contributed, that kind of thing. So that's another key piece to fill out. We also ask for a preferred email that we can contact you on when you're on leave, because often people aren't checking their work email. So like if you haven't sent me your EI stubs and it's been 2 months, then I'll need to get a hold of you somehow. So that's why we've asked for a personal email. And the last page is, oh, actually, I think I missed something. Down here is very important. So this is the maternity parental agreement to return. So this is where by accepting Plan B, the top up that you're going to be getting from the university and the benefit contributions, you are agreeing that you're going to return to work following your leave and stay on full time for the duration that you were receiving this allowance. If you do not come back, you'll need to pay it all back. So that is very important to read that carefully and be aware of what you're applying to. Now, there are some questions I've had where maybe a woman has had 3 kids. She's on her, like this is her 3rd mat leave. She's not sure if she wants to come back to work, but she is eligible for Plan B. And she's kind of like, oh, I don't know. Well, she's like, what do I do? I don't know if I want to come back. I don't want to have to pay it all. So usually I would recommend you could either take Plan A and then there's no obligation to return, or you could take Plan B, receive the top up, sock it away in an account somewhere, and then at the end of your leave, you can decide, because things can change so much in a year. You might decide, yep, I want to go back. And then in that, at least you would have the money set aside where you wouldn't need to cough up $20,000 to pay back your leave if you need to. So that's something very, very, you need to think about this before you agree to the Plan B. And page 4, so benefit and pension details. So this is where they need to know for the unpaid portion of the leave. So if you're taking Plan A, all of it is unpaid. So if you're taking Plan A, you need to decide, do you want to keep paying for both shares, the employer and employee shares of the benefits and pension? So you either accept or decline. There's 2 sections. So one for benefits is section C, section D is the pension plan. Now, if you're taking the Plan B, if you're taking maternity leave Plan B, these benefits and pension continue as is. Same with the first 18 weeks of parental leave, but then the remaining approximately 4 months, if you're going on a 1-year leave, you would have to decide for that 4 months, are you going to continue your benefits and pension or not? If you're taking an extended leave, it's even longer. It's about 9 months worth of paying for this. So it can be very expensive, paying both shares. So you can also reach out to the pension office or to benefits and ask them, how much would I have to pay every 2 weeks if I wanted to continue this? And they can give you a breakdown. For my first leave, I decided to keep both, and I think I was paying $600 every 2 weeks to continue my benefits and pension. So I was like, my second leave, I decided not to. So if you have a spouse that has benefits with their work, maybe you don't need to keep paying into yours. Pension, normally the university matches our pension, so we pay an X amount, they match the same amount, but during the unpaid portion, you would have to pay both shares. So it's up to you if you want that to keep up those contributions or not, but you can always reach out to pension and benefits to get an estimate of the cost before you decide. Okay, so that is the form. So that would have to be filled out, and now you can either send the whole thing to HR and I would then forward on this last page to pension and benefits, or you could send this page only to them. It's up to you. But that is the form that has to be filled out along with the proof that a baby is either born or going to be born. Okay, so now I'm going to share back on my PowerPoint, which I think is here. Nope, maybe this. Nope. Share, new share. Sorry here. Oh, there I am. Okay. All right, so that was the form. Now it's available on SharePoint under hiring and then under leaves and cessations. And then there's some information about how to fill it out. So for Plan A, which is the unpaid leave, what happens next? Okay. So you've sent in your form with the note. You basically would go on leave when you indicated you were going to be off, have the baby. You can email HRIS and let us know if the baby came earlier. And then we could adjust your date. Like if you said you were going to go off on July 1st and you had the baby today, you generally want to start your EI and you want to start your leave like when the baby's born, or you can start it earlier. Some people want to start it on a Monday because EI only pays in a full week, Monday to Friday. So if you have your baby on a Thursday, they don't pay you for Thursday, Friday. They would start you the following Monday. So you can either let us know you want to start it on the Monday before the baby was born, and we could adjust that. And then if you were planning to come back, we would adjust your return date as well. For parental leave, same kind of thing, but you can't start your leave for parental leave before baby is born. You have to start it either the day baby is born or after. So once we have processed your leave, we'll initiate what we call a record of employment, and payroll will send that electronically to Service Canada, and they will match that up with your application, and they will make sure you're eligible, that you've worked enough hours, and then they will start paying you the EI benefits. And because it is an unpaid leave, the university doesn't pay you during this time. So there's really not anything you need to give us, or nothing happens until when you want to come back. Generally, your employer would get an agenda message to their VIP saying, or like an email VIP agenda message saying so-and-so is set to come back on this date. And you would just coordinate it with them as if you want to come back on that same, the date you planned, or if it was a case where your contract was maybe ending only a few months later, then in that case, you would not be returning if the contract hasn't been extended. So if you're taking Plan B, so you've sent in your form and your doctor's note, and HR will set you up with our leave. Usually I will send you an email saying I've set your leave up with this date. And same thing, if you have the baby really early, if you want to change your start date, you could either pick as of the closest Monday, or you could change it to the day baby was actually born, and we'll adjust it in the system. If you're taking the parental leave, you will basically just start the leave as of the baby was born, or whatever you said on the form. I should say we expect that you will start your leave on the date that you indicated on the form, which we don't know necessarily if the baby, we don't usually find out when the baby actually was born, but we will start the leave as of what you put. And unless we hear otherwise, we're assuming everything is good. Payroll will generate the record of employment for either maternity or parental leave. And once you have reached your last day of work, then they will send all that information electronically to Service Canada, and they'll match it up with your application. So you'll apply for EI benefits. And because you're getting top up, what we do is we take your salary and we estimate what we think that EI is going to pay you. And we do an estimated top up until you can give us your first 2 EI stubs. Then we'll know for sure what you're getting from EI, and we make sure that our salary top up is accurate for the remainder portion, and we make any adjustments if necessary. So it's very important that you send us those EI stubs, and usually you'll hear from me within, if it's been more than 6 or 8 weeks, if I haven't received them yet. So then you would just keep getting paid for the top up portion that the university pays you. Once you've hit the end of that, then you would just be getting EI only. And as it gets close to you needing to return to work, you would coordinate your return date with your employer and or your supervisor, and they would have to send in a return to active status form to return, like basically to start up your pay again and your benefits and that kind of thing. So I just have a few basic scenarios because I know there's a lot of, it's very complicated with the amount of weeks you're eligible for and top up and things like that. So this is like the most standard basic scenario. We've got Jenny. She wants to take a 12-month leave in total. She's looked at the eligibility. She is eligible for Plan B, top up. She's due in September. So what could she expect to receive pay-wise? So what she would get is, so let's say she went from September 1st of this year to August 31st of next year. She would get 2 weeks of full pay, so 100% of her salary. She'd get one at the very beginning of her leave and one at the very, very end, right before she comes back. So after her first week of waiting period pay, she'll get 15 weeks of maternity leave top up. So she'll get 45% of her salary paid from the U of M and 55% of her salary from Service Canada. Then she'll flip to the parental leave portion and she'll get 18 weeks of top up, which is 40% of her salary, and then 55 of EI. Then she'll go to the unpaid leave portion where we don't pay her. She'll only get 17 weeks of EI, which is 55% of her salary, which is to a max of $638 per week. So the total of the leave is 52 weeks. The next scenario is Alyssa wants to take an 18-month leave. She is eligible for Plan B, due September 1st. So she would come back in March of 2024. So what could she get pay-wise? So she'll still get 1 week of full pay at the very beginning, which is while she waits for her EI to kick in. She'll get 15 weeks of maternity leave top up, which is 45% of her salary, and 55 of EI. Then she gets 18 weeks of parental leave where she gets 40% of her salary and 33. So because the leave is stretched out to 18 months, EI pays you a reduced rate. So instead of 55% of your salary, they pay up to 33%, but the U of M still pays the same amount of top up because we're paying it all at the front end of the leave. So then you'll have a longer portion of unpaid leave, which is up to 43 weeks. We pay you nothing, but EI pays you 33% of your salary. So the total is 18 months. And then the person would come back. And so for both these scenarios, they were both paid the same amount of money from the U of M in the same amount of time. It's just the EI that was stretched out longer for Alyssa's case. So if either of them wanted to know like how long do I have to come back to work before I don't have to pay this back, it would be the same amount of weeks. It would be the 2 plus 15 plus 18, so 35 weeks is how long they would have to be back working full time before they would be free to, you know, quit and leave and go to another organization or something like that. The third scenario is Sam wants to take a standard parental leave. So that would be the 12, where the leave has to be completed within 12 months of the baby's birth. He's eligible for Plan B. His baby was already born June 1st, and so maybe the mother is on maternity leave right now. He doesn't have to wait till she's done to start his parental leave. He can take it at any time because baby has already been born. So he could take up to 18 weeks where he gets the salary top up. So 40% of his salary. And then there would be 17 weeks where he gets no money from the U of M, just EI. So I just wanted to cover a couple of questions that we commonly get asked. So when do I apply for EI? So if you're going for, like, I've heard from parents, there's not really a point to applying for EI too early. If your baby was due, say, July 1st, it's really best to wait till the baby's actually born, because then you'll know their actual birth date and you can figure out, you know, your start and end date of your leave. It's a lot easier to just do it one time than to put in a date like a few days before baby is supposed to be born and then have to go in and change it later. So you can start your EI early though, like I mentioned. So if baby's expected to be born July 1st of this year, you could start it Monday, the 27th, if you wanted. And that's actually perfect because it's a Monday, you'd get a full week of EI. Like, so it's, you can always start the leave earlier than when the baby is born, but you can't start, you're generally not supposed to start your EI after the baby is born for the mat leave portion. So if I was to give you advice when to apply for EI, I would say after the baby is born. I want to extend my leave. What do I do? So this would be like if, say, a mother gave birth and she only took maybe the maternity leave portion, and she's like, oh, I thought I was going to want to be back, but I want to be off longer. Yes, they are entitled to take the leave, the parental leave. They would have to write as soon as they know about it. There is actually not really a set amount of weeks that you need to give notice, but I think generally 4 weeks notice would be preferable because they would need to make arrangements for what to do with, covering your position and that kind of thing. And then HR would need the updated form so that we could extend your top up if applicable. I want to come back early. What do I do? So it's always easier to come back early than it is to ask to go on longer. You need to give 2 weeks written notice before you plan to come back. So it's not very much time for the unit to make arrangements. But the baby has come early. What do I do? So yes, let HRS know as soon as possible. And we want to be able to amend your leave dates. So we always want to make sure that your U of M leave start date is the same as your EI so that you're not missing out on any EI benefits. So, I mean, we don't always know if people had their babies early or not, but we do hear about some. So that would be best to do. If for example, though, you were going to start say baby was due July 1st and you were going to start it on the 27th, even if baby came like after the 27th, it's okay, as long as we've already started your leave before the baby's born. How long do I need to be back to work before I can go on leave again? You need to be back to work full time for the number of weeks you were paid by the U of M. So to go on a second leave, you have to be back the number of weeks that you were given that entitlement. What if I want to quit the university shortly after I return from leave? You would have to repay the full cost of the salary of top-up, benefits, and pension contributions. So I know that's a lot of information to absorb. I don't think there were any questions I'm just going to stop sharing here. Melissa, did any questions come in during the presentation, or does anybody have any questions for me now about anything?
There's one from Teresa.
Okay.
Hi. So my question is, what if you have to come back and work, what if you end up having to go on maternity leave again? So like, what if the birth rates between the two kids is quite close?
Yeah, that does happen. So so you can still go on another leave. It's just that if you don't have enough time in between the two leaves, the second one, the second leave would be a plan A. So you would get the time off, but you just wouldn't get the top up. So I guess when I should have been more clear about, yeah, to be eligible for another top up, you have to be back for the duration, like the 35 weeks working full time before you can go on another leave.
Got it. So as long as you meet that 35-week criteria, you could go on again, qualify for 2, and you would only have to pay back for the second leave because the first one would have been like, you would have worked the right amount of time.
Mm-hmm.
Okay.
Rhonda has a question.
Hi there. It says the policy I printed off last year says for an extended parental leave may elect to spread the allowance evenly over the extended leave. Has that changed? Because we actually did have an employee do that.
It has changed. We I know it needs to be updated. We maybe made an exception. I think when the 18-month leave was coming into effect, there was sort of like a lot of discussion about how can we do this. It was just very difficult logistically to have different scenarios for all of the different employees and all the different groups. So if one person took a 16-month leave and they wanted to spread the U of M top up over, and then another person took a 14-month, it was so hard to keep track of how to pay them. And also, I mean, it doesn't happen very often that employees want to come back early. It's actually more common that they want to stay on leave longer, but we just felt that paying it all upfront was better for the employee because they would get the top up sooner. And then I know they would have to kind of budget for the remainder of the leave, but we just felt we really needed to standardize it so that we didn't offer like so many different ways of getting paid. And yeah, the policy would need to be updated, just like the part about not being eligible for Plan B if you're in a project position kind of thing. So there's some things that have to change in the procedure.
Thank you very much.
Do you have any other questions for Allison?
Okay, well, if you like, I am the main point of contact for receiving the leave forms and for answering questions. If anyone has a question about sort of a unique scenario, or, you know, sometimes we get questions where someone's on a sick leave and then they are going on a mat leave, what happens? And so things I should have mentioned, yes, if you're on a sick leave or any type of paid leave, that does not impact your eligibility. You're still considered an active employee while you're on a paid sick leave. So we do get some people where either it's a totally unrelated reason for being sick, or it could be because of them being pregnant, being on like bed rest or something like that. But then you could just immediately start your mat leave following the sick leave. So that's another thing I wanted to mention. But you can always reach out to me by email or contact the HRIS email and they can forward the questions to me. And thanks for letting me, this is my first session, so yeah, let me test out the information and hopefully it wasn't too complicated, but yeah, generally the main things are either does the person want Plan A or B? And then from there, do they want to go for up to 1 year or up to 18 months? And so that will then help guide them for how they would fill out their form and how to apply for EI as well.
Great.
Okay, good.
Allison, it was very informative. And thanks everyone for attending and taking time out of your day for attending our session. If anybody has any other questions, feel free to email me or Allison and we'll make sure that somebody gets back to you right away. All right, thank you. Have a great day.
Bye.